We'd like to introduce you to 3 of our care nurse participants from 2021, who will give you a brief insight into what the care programme meant to them. So please welcome Jenny, Catherine and Jane.
Hello, my name is Jennifer Crozier. I took part in the care programme. I'm trying to explain to you a little bit about what it is and what it meant to me. I had certain expectations of the care programme. I thought it was just another leadership course that I would do and gain some more information and some more development, but it was much more than that for me. I've managed to meet some wonderful people, some inspirational leaders that have taught me quite a lot along this journey, and they teach you to look after yourself, to be empowered, to inspire others, to care. It's a really good course that focuses on self. One thing I got from the course was that it actually affirmed what I felt a leadership style should be, so that you are allowed to have care and compassion, and you don't have to distance yourself. It definitely is something that's done a lot for me. My career has actually, in my eyes, catapulted since doing this course. I seem to have had the courage and confidence to go above and beyond. Some of the things that I've managed to do since being on the course, and it may not be just because of the course, but it's definitely given me more confidence and courage to do it. I wrote 2 articles that have been published in nursing journals, one in the Nursing Practice Journal and one in the British Journal of Nurses. That was definitely a career high for me. I've been able to speak at the GM Primary Care Awards in front of quite a lot of people and influential people, and do a presentation to express what I've done as part of the course, which again was a massive career high, and I'm really pleased that I was able to do that. I've had some situations, I've come across emergency situations actually out of work. So whilst I was on holiday abroad, a young child, 5-year-old, was taken out of the pool, and he was very limp and he'd drowned, he wasn't breathing, he wasn't alive. I took the initiative to go over there to immediately assess this child and to commence CPR. It was very emotional, very gut-wrenching, but the child did survive and come back to life, and you know, I think I had the confidence to lead that situation, so it definitely impacted me, part of the course for that actual situation. The other things I've managed to do, there's too many to mention. I put myself out there now and I go for my goals and I go for what I want to do. I think more recently I've actually applied to step up. I've always wanted to do advanced practice. Never thought that I'd be able to do it at this early stage in my career. However, I've applied to go ahead and do that. And yeah, I can tell you great news that I got the job. So I am now a band 7 and will be a band 8A at the end of 2 years. I lead with care and compassion, and my team tell me so every day. So thank you very much to the care programme.
My name is Catherine. I'm one of the participants on the care program. I did gain a lot from the care program, and it has enabled me to go from novice practitioner to a confident practitioner. I did the care program when I was just 3 months into practice nursing, and I've gained a lot of experience and it has helped me to develop my leadership skills and to be a good role model and to know that you can be a good leader without any drama. And it has empowered me to be able to know what I want to do with nursing and where I want to be in nursing, and that has helped me to be able to apply for the training, advanced clinical practice, which I will be starting in September. Thank you.
My name is Jane and I'm a general practice nurse working in the Greater Manchester area. Although I've been in nursing for 35 years, I've only been a general practice nurse for about 6 years. I felt like I'd got to the point where I came to work and did my job and went home, and there wasn't an awful lot in between. With the emergence of COVID, it allowed us to work across a PCN network to provide a successful vaccination programme. And this was great because it meant that ordinarily I wouldn't work or meet with other nurses and other health staff at the other practices in our PCN. So it was great to kind of network and really get to know people. Throughout this process, I became aware that everything that went on in the PCN was very practice manager and GP led, and I quickly realised that there was no nurse voice at all. So when I attended the care programme, I felt that they gave me the skills, empowered me to become that person, to have that voice. I work in quite a large nursing team at my practice, and there was nobody really that would ever speak up, any of the nurses, to actually give the nursing team a voice. So I feel that the skills that I learned throughout the care programme allowed me to do that. And I found that I was listened to, and I am listened to. I've completed some really successful projects since the care programme, and really focused on our the health of our population, of our patients, and have come up with the other nursing team with some really quite innovative ideas to engage our patients. I was also very lucky, since I did the care programme, to be nominated and to be successful to win the award for the General Practice Nurse of the Year, which was absolutely amazing. I find that I've got a newfound confidence. I enjoy my job a lot more, and it's made me become much more self-aware. So I'm really grateful that the care programme has given me the opportunity to be able to do this.
Well, thank you, ladies, and some amazing inspirational nurses there, and fantastic testimonials for taking part in this superb programme. I'm sure you'll agree. Many of our nurses quality improvement projects developed during COVID, as you can imagine, and many of those are still continuing now. A lot of them are around the community impacts of their projects, were really quite many that looked at specifically around diabetes and targeting certain groups in the community with group consultation skills. It may have been connecting frail elderly adults in their community to reduce loneliness, or it might have been targeting specific areas of health inequality like cervical cytology and smear uptake, or even developing a community garden to support mental health and well-being of residents and patients. So some fantastic projects that went on throughout the whole of this programme and are still continuing today. Next slide, please. So what are those wider outcomes? Well, we've heard from Jenny, Jane and Catherine around the encouragement and the empowerment they had for their continued development. And this slide, I feel, sums it up perfectly. This cohort of nurses have achieved some fantastic, exceptional outcomes, both for themselves individually and for their patients and communities, when really they were through a very unsettled and challenging times, both professionally and personally, for many of us through COVID, and we congratulate them for that. Inspired and encouraged and moved onwards. Some have become nurse directors, some have become primary care network nurse lead positions, some have written articles for national journals, like Jenny said, presented their project health improvement outcomes internationally and nationally. Some have starred at national and local conferences and gone on to speak to big auditoriums. And others have gone on to receive national awards like the Queen's Nurse Award and local awards like the GPN of the Year Award. I think you'll agree the care programme has provided us with some superstar nurses in Greater Manchester. Next slide, please.
So we're really pleased to advise that we've been fortunate enough to secure funding for 90 places in 2022. We're working in partnership with Greater Manchester Primary Care Federation, and we're delighted to launch the programme today. The format will remain the same. It will be an 8-week programme, and it's a 4-hour-a-week commitment. So interestingly, and of I'm sure interest to you today, 30 of the 90 places are committed to our primary and community nurses. So that includes district nurses, healthcare support workers, nurse associates, as well as our GPNs. There's 2 cohorts, as you can see here, one starting in October and one starting in January. Next slide, please, Johnny. We'll share this flyer with you shortly, which includes all the details, and we will actually put the contacts in the chat as well. So if you don't see it in your inbox, then do give us a nudge and we'll send it on to you. Next slide. So kind of why do we want to replicate it? I'm sure volumes kind of added to the slides today in terms of why we want to replicate it. But actually from the 1st of July, we are an integrated care system. We aim to come together to plan and deliver joined up healthcare and improve the lives of people who live and work in GM. And of course, that includes our workforce. We want to encourage equity of access to our programmes, which enhance and supports growth to tackle the complex changes that we face. Next slide. We did actually conduct a survey of our Greater Manchester general practice nurse workforce in 2020, and you can see on the right-hand side that it demonstrates how COVID served as a powerful blow, which really exacerbated people's feelings and the pressures that were placed upon them and services. So care came at a really, really important time, and the evaluation and feedback that's been shared with you today was tremendous, and we want you to experience that too. So my question to you is, do you want to feel empowered, energised and inspired? We're confident that you can achieve similar benefits to that of our 2021 programme participants, both professionally and importantly, personally. So your care starts with you. So please consider giving time to care and give yourself the opportunity.